Welcome to the new season of the Investments for Impact podcast hosted by Villgro Africa. This season of the podcast is going to be focusing on the topic of artificial intelligence. And I have two expert guests here with me, and I'm going to briefly speak about them, but I'll also allow them the chance to introduce themselves. So, first off, we have Rob Beyer, who is the executive chairman and co-founder of Villgro Africa. And then we have Dr. Deogratias Mzurikwao, who is the AI sector lead, joining us. So I'd like to invite you, Rob, first of all, to just briefly introduce yourself. And as you do that, I'd like you to speak a bit to how you found yourself in AI. How did that light bulb come on for you when you realized that AI was going to be pivotal for Villgro's work going forward?
Thank you, Moses, for the question. And hi, Dr. Dio. It's good to see you again. I've been, my name is Rob Beyer. I've been with the Villgro Africa team from the very beginning when we explored how Villgro from India could expand to Africa. And that was in 2014. And through that, from that time onward, we've been staying in one sector, which is health and life sciences. And I've been part of that journey along with our co-founders, Wilfred and Dr. Robert. I've been fortunate to live in Kenya for over 20 years, but I'm Canadian by passport. Great question on AI. In the early days of Villgro, we weren't seeing a lot of tech-oriented companies. We were seeing more bricks and mortar services, some med tech early on, some diagnostics very early diagnostics. But around 3 or 4 years ago, we began to see more and more tech-oriented innovations. And some of them, the word AI was starting to be seen. It was evident that some companies were grappling with it. It was still early, like it really accelerated the last few years, as we know, but 3 or 4 years ago, it was still quite new, but we began to see it there. And it was around 3 years ago, we noticed that one of our funding partners, the International Development Research Center in Canada, IDRC, put out a request for proposals around their AI for D program, which was a very new program then. And we were already working with IDRC on an impact voucher work. And we reached out and said, hey, we'd love to speak to the lead and hear their thoughts. So we had an initial contact and shared what we were seeing in early stage companies around AI. And we decided to do a very small pilot, to do a Pan-African call, which we called AI for D. And we had no idea at the time what we would see, but we received a couple hundred applications, and it was clear that there was a significant need there. That call was cross-sector, and so we had some in health. Majority were health, but we had some in ag and some in financial inclusion and fintech, and it was part of that round where we got introduced to Dr. Dio. Dr. Dio has a company in Tanzania called Xsense AI, and he applied as part of the AI for D program. And we were thrilled. As soon as we met Dr. Dio, we were not only impressed with what he was working on, we were as or more impressed in what he could do to be a potential lead at Villgro for the AI sector. And so that probably preempts your next topic, is to introduce Dr. Dio. But he joined the team a couple of years ago, and he's been a big part of our AI and our next phase in the last phase at the end of 2022 and 2023, which I'll allow him to share about. That's a little bit of intro about me and some background into how we got into the AI space.
Thank you, Rob. So over to you, Dr. Dio. How did you find yourself in AI? I know you do have a technology background, and you will tell us about that. As you do, please tell us how did you find yourself in AI?
All right. Thank you very much, Moses, for the great questions and good words on how Rob managed to poach me. We met in a very strange way, but they've built a very remarkable journey, like making the impact of AI to all of Africa instead of just within my company. This has been a very interesting journey. So basically, I had the first word regarding AI when I was doing my undergraduate. My first degree was in electronics and communication engineering, but my roommate was doing computer science. And for us in electronics and communication, coding, developing this algorithm was not a core subject, but my roommate who was doing computer engineering, it was the core subject. And maybe because I studied an Indian originated university here in Tanzania, in which more than 90% of the lecturers were from India, we were lucky to see these new technologies within the universities. And one of the subjects which my friend was studying was in artificial intelligence. By that time, we didn't really understand. So I used to hear the name artificial intelligence, and it was some kind of interesting word to me. So from there, after I graduated my first degree, I applied for a scholarship to go to China, and it was during the application when I saw one of the courses was in artificial intelligence. This is when this was in 2000 and 11. This was when I started like knowing that okay, there's something called AI, and this is what it can do. By that time, I was already working at a factory as an instrumentation and the automation engineer. So seeing those SCADA system, the automatic system, how they were working, but they're all hard coded. It was not AI. So it was during this time where I managed to differentiate between AI and the hard coded algorithm. So when I applied to do my master's degree in China, I went straight into AI, and that was in 2012. So I've been doing AI since 2011. It's almost 12 years now. Then in China is when I get to see the real AI, and we're just small kids at the university, the undergraduate students were doing amazing stuff, self-driving cars. I saw them, and I actually participated in one of the competition in 2014 in China, in which my team came the second run-up in this unmanned area vehicle programming. So this was the exciting period that okay, so AI is real, it's here, it's happening. Then I get into it. When I graduated from that university in 2015, I came back home in Tanzania, and I wanted to apply the technology. I established my first company called Nesc in Tanzania. Then we wanted to do AI, but nobody was understanding what we were doing, what is AI, and things like that. It was a bit frustrating, and my dad, I think, noticed the frustration in me, and he said, maybe you should go for a PhD. So basically, doing a PhD was not in my plan. My dad told me like maybe go for a PhD and you will meet the like-minded people, or maybe you can disappear there. I don't know, or you can come back to Tanzania. By that time, maybe people start understanding and absorb this technology. So then I went to the UK to do my PhD, and luckily I just chose healthcare. So my PhD was the applications of artificial intelligence in healthcare, which was a great journey, like getting my hands dirty in real data, healthcare data, for the 4 years in the UK, 3.5 years in the UK. Then I came back home, so I knew what is AI. I knew the need in Africa, and I wanted to apply now my skills. This is when I established Exsense AI, and I was looking for funding. Then the funding came through Villgro, as Rob already mentioned. Uh, it was a bit strange the way they picked me. I remember when I applied, there was conversation happened there regarding AI. Then one day it was me, Robert, and Rob who had a meeting. I wanted to show them the algorithm I built when we were analyzing social media data. It was Sunday, and Robert and Rob, the way they were looking at the analysis, I just find like, okay, someone can hear and listen and understand what I'm doing, and not most of the people who I was meeting, they're looking like I'm doing some rocket science or things like that. So I just find myself comfortable talking to these people, Robert and Rob. And yeah, they gave me my first funding for COVID-19, which I created an algorithm. Then I came for breast cancer, and it has been an history, and I've been enjoying the journey. And now it's not just within my company. Now at least I can impact more companies that are in Africa, and I really like what I'm doing.
Thank you very much for that introduction, Dio, and just for setting the stage for us. Now, just moving a bit deeper into the topic, coming back to you, Rob. So, we started to see some AI applications. We talked to IDRC and they gave us an opportunity to delve into the sector. Now, since then, how would you say things have developed? You've given us the past. How is it looking like now? And
Yeah,
how has the journey tracked from then till now?
yeah, thank you. If AI for D was a pilot where we, funded about 10 companies around $10,000 and had some significant learnings, it was really clear from that the majority of the focus was in healthcare. And that it was also clear that there was a general lack of understanding around what AI is. And so Dr. Dio on the first round was one of the few that had a clear, strong presence and indication of AI technology, where others were not really using machine learning. It was more maybe some data analytics, data statistics being sort of angled as AI and machine learning, but it really wasn't traditionally what we were looking for. But it showed really promise in healthcare. So upon learning about the success of the first round, the AI for D and IDRC came up with a larger program to just focus in healthcare. So our current cohort is called AI for H, or AI for Health. And that particular one has a larger ticket size and a lot more technical support, and really gets the full Villgro experience around business acceleration, master classes, hands-on tech support. So each company receives strong business expertise from the Villgro side, maybe from myself and our team, but also really strong technical support from Dr. Dio and his networks around the AI side. And so we're really putting a lot of energy into scaling these companies, and they get a little more ticket sizes, upwards of $50,000, some of them, to really scale and grow. So that cohort is currently active, and we're really excited about what we're seeing there.
Thank you, Rob. And at this point, if we could just go backward a bit, I'm curious to find out, in your view, and I'll ask this question to Dio too, why is it important for uh, us in the health sector to think about AI, to apply AI? What's the value of AI in health, basically? So, Dio, over to you. Why is AI important in the health sector?
Okay, so by 2021, the AI sector was producing around the 20 zettabyte of data. If I can clarify that, and 1 zettabyte is equal to 1 billion gigabyte of data. And this is projected in 2025 to grow to 175 zettabyte of data will be produced by healthcare alone. And this is the sector which produces more data than any other sector. But look at the manpower that we have in Africa. Even the rate of producing these healthcare experts is not matching the production of this data. And maybe if I can explain it a bit more, why we are seeing this rocket rising data producing in healthcare is because of the advancement of technology. Now we are having wearable devices. You can have a smartwatch which can tell you about your heart rate, about your sugar level. We have wearable glasses. We have implants like the pacemaker and those kind of things. So all these digital technologies are producing tons and tons of data. So we need someone to analyze this data. If you go to the hospital, you take a chest X-ray, you need a radiologist to read the image. But now we are having portable digital X-ray, which can be rechargeable, and you can take it even to the rural areas. But no radiologist to read there. If you go to the pathology for cancer screening, now you are seeing this affordable digital microscope which can analyze these samples. Some are even embedded into mobile phones. So all these data still go to the same human experts that we need them to analyze. So it's impossible for human to keep with this pace. And one thing to remember, even if we have some good medical doctors, in the morning they can perform better. But as they keep on seeing more patients during the day, they're human. Their capacity will start slowing down. Maybe they'll need to take a rest, or they can start making human errors. So we need computers, we need other techniques which can help with the analysis of this data. So we need AI in healthcare more than in any other sector. This is why we need AI to cope with the amount of data being produced. And for those who are a bit aware of AI rely on data. So if the healthcare sector produces data and AI needs data, so the two can easily come together. We just need to regulate it and make it clear. But healthcare needs AI more than any other sector.
Thank you, Dio.
Moses, I'll add to what Dr. Dio said as well, because I see it also from in a continent that has so much lack of quality primary care and such few physicians, that the practical expression of AI when it comes to aiding in diagnosis in all kinds of different areas is, to me, incredibly exciting. When you have so few pathologists and so few radiologists, that the potential of AI making these people so much more sort of efficient by having AI maybe initially screen electronically and bring more serious cases to the top immediately, and those that show little indication of any challenges down below, it can have an immediate effect of giving some indication of priority to patients that need it. But it also allows sort of much more diagnosis to happen as well, or at least screening to happen. I know it'll take time for AI to be regulated to that point, but the potential to me is incredibly promising to improve primary care sort of access and diagnosis.
Thank you. Thank you. So I like that. We're saying that the health sector generates the most data, and we are also saying that there is great potential to improve diagnosis, and there is great potential to leverage AI to cover gaps in terms of human resources for health. And this is really, really useful for Africa. I'm wondering, how does AI play out when it comes to the financial side of the health equation? Any thoughts on that?
Yes,
Yeah, you are hitting on. Go ahead, Dr. Dale, please.
Yeah, actually, it plays a huge role. First, in terms of access, because I'll give you an example. In East Africa, we have very few hospitals with cancer screening capacity. And all these hospitals are in big cities. So we are losing a lot of cases in small cities because these people will need to travel, find accommodation, and all those costs in big cities to have diagnosis. And all know cancer diagnosis is not something for 1 or 2 days. It can take a couple of weeks. And if the hospital is overwhelmed, it can even take months. So we need some access to this kind of services. Plus, and I will actually use a very existing example to show the impact of the AI in the financial sector, in the financial side of the healthcare. Here in Tanzania, the Tanzania Ministry of Health, under something called the National Tuberculosis and Leprosy Program, they're using artificial intelligence for screening of TB. So they use chest X-ray, then all this to upload into the AI algorithm, and all those suspected cases will now be taken for the confirmatory test. As Rob mentioned earlier, that yes, it will take a while for AI to be regulated to the diagnosis level, but at least now it's being used for screening. So previously, when the ministry was doing screening of TB, they were using something called Gene Expert, where you have to take the sputum, then they analyze in the lab, and to analyze the sample can take up to 4 hours. And the one cartridge of Gene Expert costs, I think it is around $20. So all the cases coming to the hospital were going for this Gene Expert, which was extremely expensive to run. But now they're using artificial intelligence for screening. So only suspected cases will go for Gene Expert. So the number of cases, and we analyzed some data here in Tanzania that out of the 10,000 patients who were screened, only around 200 were positive cases. So you can see like the 9,800 cases which used Gene Expert, it was not necessarily. But if you do screening and have maybe out of the 10,000, maybe 2,000 are suspected and they're being subjected into Gene Expert, it means you have saved more than 8,000 cartridge. So it affects the financial from the government side, which is the major provider of healthcare services, to the personal level, that instead of you traveling from maybe 100, 200 kilometers away to get a hospital, where you can go for screening of tuberculosis, there are mobile vans which move into villages and things like that for screening of TB. So it affects like from the bottom up to the healthcare provider. So the impact is huge.
Thank you,
Back to
Rob.
Europe.
Thank you, Dio. Over
Yeah.
to you, Rob.
Yeah, I'll also like what's first of all, there's not, because AI is so new, there's not a lot of use cases and business models to sort of emulate and follow, and we recognize that at Villgro. We are working hard to sort of uh, create opportunities where companies can actually benefit from AI from a practical perspective. It's still quite new on the continent. It's still, because AI is quite new itself. But from a conceptual lens, we could definitely see that AI will be good for business because it'll likely allow much more volume than what's happening now. Without AI, a pathologist or radiologist, for example, use that example again, can only see so many cases a day, can only record on so many cases a day. There's only so much that they can do. Well, AI can open that up and be really effective at screening and increasing volume, which is good for patients because there's more patients that'll be seen. Also, diagnosis can be more diagnosis happening, which could also be good for the radiologists and pathologists. They'll actually make more money because they're doing more volume, but at the same amount of work, for example, as what they were doing before. So I see it as a really win-win here. More volume, more patients being seen, more diagnosis, and not at the sacrifice of more work for pathologists and radiologists, with that example. So yeah, I see it really strong, but it's still evolving. There's not a proven sort of case studies you can emulate. And that's what we're focusing on with our AI sector, is really trying to come up with business models that can show the promise of AI, not just from a technology standpoint, but also a business model standpoint.
Thank you, Rob. And I'll pick up on a point that you made on the fact that it's still early days and we're still trying to build business models. And I'm wondering, what do you see as the main challenges faced by the companies that we are seeing in our AI for H program?
Yeah, there's two broad buckets, first of all, of companies, and what I call data miners and data modelers. Data miners are those companies that can, in what they do, generate consistent new data on a daily basis. To Dio's point about data generation, they are companies that can generate data, whether it's diagnosis data or image data, certain healthcare related metrics that they can generate that just by what they do, and they're a data miner. They can constantly generate new data. Then there's data modelers are those that need the data, that want to work on the AI models that will be built into the devices or the technology that we shared about earlier that people will benefit from. Both of them have different business cases. Both of them are still very much evolving. We know that data miners can, for instance, create platforms that can be open, where they can put up certain data that people then can access for free. It'll be open in the aspect that it's available, but whether you're a researcher in global north or a local researcher or an AI data modeler on the continent, you can access that data and use it and test your models. And for a data modeler, you could be working on your innovation, and once your model's done, you can license it and build it into some other technologies platform for a fee. So those are broad areas where we're going with this. But again, it's early days, but we can see promising areas where we think there will be a viable business model for either one of those categories.
Thank you, Rob. And to you, Dio, at what point does it actually become artificial intelligence? So Rob has spoken about the miners and the modelers. So if you could just maybe complete that equation, when does it actually become AI?
Okay, all right. I'll also bring in the concept of data science. So initially, we had statisticians who were doing statistical analysis of the data. Then later on, we had people who were called data scientists, who were analyzing the data, plot the graph, and tell you what's happening within that data. Then people in AI initially were waiting for data scientists, as Rob mentioned earlier. We're waiting for data scientists to clean up the data, make it ready for AI machine learning application. And those people at the end were just building the models, as Rob mentioned about data modelers. But now they're trying to bring up to lower the gap, that the same individual who is building the models is also involved into data cleaning, data processing, like the data which were used to be done by data scientists. And the main reason is people who are doing the modeling, sometimes they need a particular type of data which the data cleaner or the data scientist didn't prepare that data in that way. So when you complete all this cycle in between, and you have something, an algorithm, which can automatically make its own decision, like the data is no longer there. And many people, this is where they make a mistake. They think AI is you have a database, and when a new data is coming in, you will compare with what you have in your servers, and it will tell you the results, whether it is cancer or not, based on the data that you have. It's not that way. Basically, you use the data, as Rob mentioned, like those who are collecting data, the owners of data. Then the data modelers will now train the AI algorithm with this data, and the data can be deleted. So the algorithm will just stay with the knowledge of that data. If we take an example of you, Moses, that you don't need to store pictures of my face in your head to be able to identify me in the streets of Nairobi. But since you have seen me a couple of times, you have heard my voice. So anytime, maybe when I call you with a new number, your brain will quickly pick up like the feature that your brain have extracted from my voice. No, this is there, just from the noise, before you even see my face. Or you can see me from far before you hear my voice. Your brain will just connect the two, that this is the person you have heard him a couple of times. And back to the point which was mentioned by Rob, one of the things that we came to mention, to realize through our previous couple of years in the AI, we find a huge gap existing between practitioners of AI and the researchers of AI. And this is what we are largely trying to bring the gap. Rob mentioned about making the data set available to everyone and open it, make it accessible. You find a very good research happening in the academic university, and they have a very good result, but they don't know where to take it. The intellectual property about it, the regulations that exist to make sure they take the product to the market, the finances, the commercialization of it. It's a gap which at Villgro are trying to address. On the other hand, on the AI, on the private sector, the innovators themselves, you find a very smart young kid in Kibera who just locked himself in his garage, a pretty good coder, but he don't have access to data. That's the gap Villgro we are trying to address. Or he doesn't know the intellectual property behind it. That's the gap Villgro is trying to address. Or they don't know how to take their product to the market. That's the gap at Villgro we are trying to address. So basically, we're bringing to closer the researchers and the implementers to make sure that the products that are being created in Africa, they go and change the healthcare at the very bottom. And not all the good finding in research communities to end up in paper publication, or all those nice smart coders in Kibera, they just end up in their bedroom. We want to see business happening. We want to see the solutions happening in the street. We want the data set to be accessible by anyone from the global north, global south. The data is available, a well-trusted data, and protecting the people who are donating those data to make sure the privacy and everything are protected, and the intellectual property.
I really appreciate your explanation, Dio and Rob, how you've broken down the ecosystem. There are many players, but at the moment they're more or less siloed. And part of Villgro's work is to break down those silos so that we see more collaboration between the miners and between the modelers. We also need to be able to develop business models that are viable to allow that to be commercialized. Now, moving on from that, I'm curious to hear your opinions on the subject of regulation. And usually in innovation, as we do know, innovations usually precede regulation. And the challenge we find is that sometimes regulation can be can be restrictive. So how would you advise regulators going forward on how to regulate this sector in such a way as to allow it to grow rather than to stifle it? Starting with you, Rob.
Yeah, thanks. I'll defer to Dr. Dio, who is probably more knowledgeable this than I am. But what I see happening, what I wish we don't have, is the launch of ChatGPT had brought AI right to the forefront. What I would say, where people were largely not prepared for it. That would be my opinion. That regulators, and it generated a bit of a, maybe there was a lot of fear that in the early days of ChatGPT came out. There was a lot of sort of discussion around the very disruptive nature of AI, that the nature of all kinds of jobs were going to disappear, and it was some of it is true, but I think there was a lot of also just sort of a fear-based approach. So I would caution that regulators don't give in to a fear narrative and be so restrictive that they make the guardrails such that innovators can't even happen anymore, because it's such a fear of potential harm, that I would hope that they would go about it in a really sort of more structured way and put guardrails in place that allow innovators to feel confident and feel free to innovate and come up with new ideas and new innovations, than to be so stifling. And that's from a high level what I would love to see. But Dio, what are your thoughts there? You're on the front lines talking to regulators. What do you see?
Yeah, actually, the regulations have been very tricky, especially here in Africa. But it's a common thing that innovations is always ahead of regulations. Like the regulator need to see things happening, then they see the importance or the necessity of regulating it. Because even now at Villgro, in this second cohort of A4H, we've been trying to involve regulators so they can see what is already happening in the private sector. For them, they don't have that opportunity like the one we have, seeing how innovators are already building things, and they will see the risk that are going to face. And the risk is, I'm referring to both that for creating harmful products, but at the same time, when they want to register their product, like there's no any clear policy, there's no any regulations. So we have been trying to push to involve regulators from all of Africa, that to show them this is what is happening, and this is why you need to regulate. So it's something we are still pushing, but our early learning, it is still yet hard to identify who exactly need to regulate AI. That is, it's a question that we are trying to answer, and we have reached out to several countries in Africa. So even for themselves, they don't know who is responsible with that yet. But we are not giving up. We are still pushing them. Like we need to get someone or a certain authority within the respective countries to regulate AIs, because there are also some risky. Look at the US. When anything happened, or even the UK, the global north, when something happened, you can see how the laws respond to it to regulate AI. But here in Africa, we don't have that. So it is a green pasture for innovation to happen, but also it's a room for mistakes to happen. So we need the regulations as quick as possible, and also to have common standards. At least the WHO is trying to lead on that, to have like a certain standard that if you have an algorithm which is being regulated in Kenya, then it can be used in Nigeria because it follows the standards of the WHO. Look at the FDA, a product which is regulated in the US under the FDA, everyone trusts it, and it can be easily adopted in any other parts of the world. So it's something which needs to we need to address it as early as possible.
I really like what I'm hearing, especially that you're engaging regulators to address the fear that can come with this misinformed perspective of what AI can do. And moving on from that, uh, Rob, you talked about ChatGPT, and that was sort of like a good segue to the next question, which is really around AI, particularly in Africa. So I'm wondering, from your experience so far, what would you say are the unique opportunities for first of all African innovators as far as AI is concerned? And I ask that question because when you think of AI, like the perspective is that AI is coming from, the global north or the east, from China, as Dio said, he studied there. So I'm wondering, what are your thoughts specifically about AI in Africa, and particularly speaking to the opportunities for innovators?
Yeah, that's a good question. I think it's still early days in the aspect. Our data modelers, there's still relatively few, I would say, AI engineers, maybe compared to other parts of the world. And so the ones that are here and the ones that we're talking to do struggle trying to get access to data. Some of them just struggle with that, and that can be a real hindrance. I know your question is about opportunities, but it's still an area that needs to grow and develop. That as awareness and training in the technology happens, we need to encourage and make available access to data that also sort of fertilizes or sort of incentivizes that interest and passion. So I think that's an opportunity, is to create toolkits or places where local sort of developers can test. And that goes back to the original one about the data miners and working with them, those that do generate data. If we can create platforms that data can be, local African data can be available at a reasonable price and accessible price. So that's our approach to this. We're actually doing this in a way that can solve both challenges, both those that provide data and want to be monetized for it, and those that need the data to work on it, that they can access it and then potentially license it. So I think that's the opportunity that we're approaching to solve this particular challenge. And I think that's what we're most excited about it at this time.
Thank you, Rob. And to you, Dio, Rob has spoken about the innovators. Now, to you, I'm wondering, what are the other opportunities for other players? For instance, for academia, what role do you think they can play for us as Africa to leverage AI?
Yeah, I mean, I don't want to put as a blame, but it's a learning that we've seen most of the funding in AI have been going in academic research, like a lot of it. But the truth is, we all know, look at all the innovations happening on the continent, which have changed a lot of things. M-Pesa. There's another one happening in Tanzania, Nala, for sending money from, like you can send money from the global north to Tanzania, to Nigeria, to Kenya. All of these, they didn't come from academic research. They come from the innovators with very limited funding. So for me, it's a call to all these big funders that also the private sector really need this funding. They really need this support by combining them with academia. We're already doing it at Vigo with the impact vouchers, where we are trying to combine the academia and the private sector. That yes, the private sector, they do these innovations, but they need to work with academia. So it's a very strong call from me that we need to see more applications from academia. We need to see more application from researchers. We have seen a number of them coming to Vigo that they want to commercialize their research findings, but I'm expecting to see more because they're the one receiving a lot of fundings. Also, and actually, they're the one who have more access to data. Rob mentioned that we are trying to push accessibility to data, intellectual and those kind of things. But people from academia, they have more opportunity to access data than people from the private sector. So I'll call for more involvement of people from the academia to also think of the private sector, that they can commercialize their research findings, and people like us at Vigo, we are here to assist them on how to take their research finding from the research laboratory to people at the bottom who really need their research findings, instead of just ending up in paper publications. Yes, which is good also. We need those papers to change policies, for them to rise in academic rankings. But we need to see products which can bring up the financial muscles and also can help people at the bottom who are in need, as we mentioned earlier, who are in need, especially with a sector like healthcare, which is struggling in the global south. Back to you, Moses.
Thank you, Dio. So we are saying that we need more of the data already available in academia to move beyond publication to actual innovation and then commercialization. And as you speak to that, I wonder what about the area of training? Are there gaps in terms of the kind of skills we're producing from our learning institutions? And if so, what are the gaps and what do we need to do about those?
Yes, the gap is very huge, and you mentioned a very good point because it is also one of our learning from the first call that we came to realize most of the AI innovators on the continent were self-teaching from online resources like Coursera, ADX, those kind of things. We didn't see much, and the main reason is we have very few universities in Africa, or even maybe I can say colleges or high school, which are teaching AI-related skills. And here's the thing: yes, you can rely on online resources, but most of the time, these online resources, they rarely provide trainings on ethics, on intellectual property, and those kind of things. Most of the trainings online, you'll find that just training you on how to code, how to write good codes, how to deploy your model. Like, it's solution oriented. But there are a lot of things which are involved around AI. Yes, you can innovate something, but how do you take it to the market? Where did you get the data from? How do you make sure the end user is not going to be affected? And it's something which we are trying to address at Villgro, that apart from selecting these companies, we also provide tailored training to them on ethical, explainable AI. Gender is one of the very common gap we are seeing. We have very few women involved in AI innovation, something which we are, with our partners and our AI for it, we're trying to address that. How do you deploy these solutions? We are involving people like NVIDIA, who provide online credits for computing resources. We have companies like Siemens, who look on how these innovators take their solution from their research, from their rooms, to deploy them to be used in the solution. So this is the gap that we are trying to address. But for the academia, I think it's time now to start having AI, data science, this related courses in their curriculum. Embed them. We need more people. Rob mentioned earlier that some of the people who are applying for AI, they barely understand what is AI. You can actually feel it from the proposal, like, okay, this person doesn't really understand what is AI, but where do they get this knowledge from? You can go online, even if you have basic skills on engineering, you can download the machine learning codes, you can download data, you can train and say, and I can now do AI. But the practical experience of it, which you can get from academic, and just to share an example, it's something I don't remember if I've shared it before. But when I was doing my PhD in the UK, I was forced to go into ethical training for 2 weeks, just because the data set that we obtained, a friend of mine created a mobile application which was installed to people who were recruited for a study, moving around the city and taking pictures of the things which they see during the day. Like, you move around, you put on your GPS, take pictures of something which you see during the day, and later in the day, you report about your mood. My friend was trying to match your mood and the things you exposed during the day. Maybe you saw pictures of flowers, maybe a cup, or you had a nice meal, those kind of things. And someone who has seen maybe people fighting in the street or spend a lot of time in the bar. Like, we are trying to match the two. But we went further. We were analyzing their GPS movement. We wanted to know whether these people were social or antisocial, whether they are night goers, which kind of transport they use. Is it public or private? How is their driving? Because with GPS data, you can do that. For us, it was fun that we can know that. But later on, when we reported these results to our supervisor, we were punished to go for ethical training, because our job was to match the mood and the pictures. But we went on the GPS data to analyze their movement. Like, it was privacy intrusion to know where this person, where they were meeting. Did they go to a nightclub or a pub? But you see, this kind of thing happened because we're an academic institute which is guided by ethics. But for someone who is living maybe in the streets of Dar es Salaam, having access to data which shows patients' information, their maybe insurance number, age, gender, and this person doesn't have ethics behind it, it's very tricky. So I strongly argue this academic research to start having AI as part of that training, because in the university we see this kind of training, and also at some point people in the academia to come closer with people in the innovation to share the experience and not combine their knowledge. Not everyone working separately, like they're competing, but to come together and they can create a very strong product together. Back to you, Moses.
Thank you very much. And you really touched on a topic that I wanted us to discuss before we close, which is the whole subject of ethical AI. And I'm wondering if you can just briefly explain what's ethical AI and really what are the main principles behind ethical AI. If I'm an innovator, what is it I need to know about ethical AI?
All right. Basically, I prefer to call it responsible AI more than ethical AI because ethical actually falls under the umbrella of responsible AI. So when we are training this algorithm, initially we mentioned that the amount of data being produced in the healthcare sector. So how do you access that data? Did you have any ethical approval to access those data? Does the hospital, like the patient who contributed to those data, were they told that their data is going to be used for a certain application? Are they aware of it? Are they willingly comfortable to share their data? If they are, when you are sharing this data to an individual, did you anonymize the data? Removing the name or the private information, the names, maybe the insurance number, where they are living, because that doesn't matter. Maybe if you need an image or laboratory results, just get the results, leave the private information. And did you get this data under the ethics? Like, not just because you know someone at Kenyatta University Hospital, then you get the data. So that's one. And also, why we need that ethics? Because we don't have clear policies and regulations in AI. Most of the time, when we approach people in the hospital, they can just say, "No, we don't want to share data." They don't have any reason, just because they don't want to share data or because they don't understand what you're going to do with this data. But if responsible AI is going to push on the ethics, we have clear policies and the regulation, then they can know what are the procedures to, for me, if I want to share data with someone. Just a very basic example, we know the policies, rules, and the regulation to establish a company in Kenya. So you know all the procedures. There's no one in the middle who will tell you, no, you can't establish a company because it is open, it is clear, you can do it. But there's none for data. So for data, it's like me and you, we just have to sit and talk that I need to access your data for this. The patient is not involved. The hospital sometimes is not involved. So this is why we need it. Then on the algorithm itself, when an algorithm, and I should maybe insist on this one, many information you see online, which many people rely on as the basic platform for information regarding AI, tells how good and amazing AI is. AI can make serious mistakes, the same way a human does. It can make mistakes. But most of the time when you go online, they just tell you how good, how exciting AI is. And no one is talking about when AI fails. And this I'll put back into academic research because I'm also a researcher. So most of the time we want to publish good things, amazing stuff, but we don't want to publish when things fail. But they failed a lot of time. I remember again during my PhD, my supervisor gave me an assignment to create an AI algorithm to detect the sleeping stage of a person in the hospital who have been induced a propofol drug. You know, when you go for a surgery, the medical doctors, they look at your height and weight to know the amount of drug which they should induce on you to make you sleep so they can finish the operation. But sometimes it happens and it's a very horrific experience that some people wake up in the middle of the surgery. So they wanted to know the exact amount of propofol drug they should administer someone and also monitor that patient during the operation period, like when someone is about to wake up so you can induce more drug. So when I was giving that data, I created an algorithm with 99 accuracy, and I was excited. So when I took it to my supervisor, he told me, okay, hold on, did you analyze the data first? He went to the data, not the model. So when I analyzed the data, those data came from 20 patients, but 18 of them slept. So you can see my data was already biased to the people who slept during the surgery. Only 2 woke up. So that was not a balanced data set. The algorithm won't tell you anything about it. So you see, so when an algorithm makes mistake, it's either the data quality or you didn't understand about the codes that you created. And the another part is on the algorithm. And this is part of the responsible AI, explainability. When you go to a doctor, if he's taking a chest X-ray for screening or diagnosis of TB, the radiologist will tell you you have TB or you don't have because of this, this, and this. You have fractured your bone, so you'll need maybe for a surgery because of this and this and that. Can the AI algorithm do the same? Initially, people were calling AI algorithm black boxes, but they're not black boxes. It's because people were limited with knowledge and skills on how to make them explainable, which is a very crucial element in responsible AI. So now we need people to show us, when you say this is cancer, this is not cancer, what does the algorithm look at? Is it the same as the medical doctor does? We have seen a number of competition, not competition, just people showcasing how AI can be useful in China, where you create your algorithm for maybe screening of breast cancer, but you take a radiologist, you take the AI algorithm, you let them do the job, then you compare their results, not to find who is the best, but to see if the AI algorithm also perform the same way as a human doctor. And we've seen that with the companies that we are supporting. We're now pushing them to have the heat map. Like, show us, you say this is cancer, okay, show us where are the features which makes you think it's cancer, and that is working. So that's also the point of responsible AI. And also at the end, we need to protect the humankind. We don't want to create machines which are going to do maybe racial discrimination, age discrimination. Take this as an example. If you want to create an algorithm which will use online materials to predict about, let's say, the socioeconomic status of an individual, there's a high chance this algorithm is going to be biased according to age and gender. Because according to statistics, many people above the age of 50, they don't use internet. But people from the teenagers up to 49 and 50, they're the one using internet. So if you use online data to create an algorithm, it is going to discriminate people above 50 because they are fewer. And also, many men have access to internet than women. So if you are using online data, you're already going to be biased towards men. So it's something which you need to balance at some point. So when you are talking about responsible AI, you need to take all of these things into consideration. When you are collecting data, maybe for screening of TB in Kenya, you need people from the coast. You need people from the highlands, because the way TB affects them is different. You need people from the prison. You need people from the posh areas in Nairobi, because for people in prison, maybe they've developed some resistance because of the harsh condition they have. They've developed some resistance. So the same amount of TB, if it hits someone living in some estates in Nairobi, the same amount of TB going to put that person on bed while leaving the person in the prison surviving. So those are the things that we need to consider when we are creating this responsible AI.
Thank you very much, Dio, for your perspectives on responsible AI. And Rob, I'm curious to hear what's your opinion on responsible AI?
Yeah, thanks. I'll leave the technical aspect to our specialist, Dr. Dio. But from a practical expression, it's encouraging to me because I've seen in our first cohort where there was essentially almost no recognition of responsible AI or ethical AI. It was basically, there was almost no thought to where data came from. They just had data. They, asked the question, well, where did it come from? Was it ethically sourced? The question was just met with generally a blank stare. But now what we're seeing, I think with the AI for D and GIZ and Villgro, that a lot of energy is being focused on that it does matter where your data comes from. And it's really encouraging to see more people understanding the importance of that. So what Dr. Dio was referring to, it's actually making it out there that people understand they can't just work on models without and disregard where data came from. More people are understanding that it's important and it has to be factored in. So it's really encouraging from even the last few years.
Thank you very much, Rob. And while you still have the mic, so we know that AI is here to stay, and Villgro Africa has already taken a leadership role, at least as far as AI for global health is concerned. I'm curious to hear from our learnings overall. What are your thoughts on how the future looks like for AI for health in Africa?
Yeah, really bullish. We're really excited. This is obviously a growth area around the world, and it's also a growth area for Villgro. I want to be really clear. We don't pretend to know all the answers, especially on the business side. Our specialty is sustainability, commercialization, business development. That's what we do. And as we talked about earlier, that having that framework is still very much evolving in Africa. We're really excited that we recognize that it's a challenge, and we're getting together the right people to ask the right questions to have some of those answers made available to innovators. So we envision in a year from now, imagine having a toolkit, a bit of a toolkit where future AI innovators could go to better understand areas like responsible AI and data sourcing ethically, areas to look at different case studies of different companies, how they leveraged AI in a sustainable commercialization approach and generated money so that innovators can actually copy some of that. Imagine having areas, these platforms where data is made available at a fee, open and at a fee, as we showed earlier. So I think we really see in the next year that move this from a challenge to actually providing solutions and toolkits and things that AI innovators and even academia can leverage and benefit from. So I'm excited about that for the future.
Thank you. Thank you very much, Rob. Do you any concluding remarks on what the future holds for AI in Africa?
It's very exciting, and it's nice to see now one of the initiatives that is being done by Villgro, and this is based on our previous learning that we found many of the players were working individually, separately. Like there was no combining of these efforts, these resources. And at Villgro, in our previous call, we managed to bring these people together. Like all the players on the continent, we are bringing more in. And also the challenge, which have been huge, and it was a really dramatic event for us on how to solve the access to data. It's something that we are working on it at Villgro to make sure there's a pool where people can access data, the data which was collected ethically, responsibly, and it is trusted, and the intellectual property of this individual can be protected, while even the contributors of data can also share the benefit that is going to be generated with this data. So something still in the cooking, but we are trying hard to address these challenges to make sure we are starting to see great use cases of AI on the continent.
Thank you very much, gentlemen, for lending your wealth of experience and insights from our learnings as Villgro Africa in the AI space so far. I'm really, really excited, and I'm quite happy that we had you as the first guests for this season on AI, and looking forward to touching base, Rob, as you said, about a year from now to see how things will have developed. So that concludes our episode for today, and enjoy the rest of your day. Thank you.
Thank you. Thank you for having me.
Thanks, Moses.
Thank
Thanks,
you.
Dale.
Bye.